Into your health, at least 29 people in Ohio and Michigan recently have become sick with E. coli. It's unknown at this point where that has originated from or the cause of it. Health officials are working to find that source. So far, no deaths have been reported. However, several people have been treated at hospitals. Dr. Michele Dodds now joins us. She is Associate Professor of Nursing at Cedarville University. As we talk about this spread, Dr. Dodds, let's start with the basics here. What do we know about the size of this outbreak so far and the number of cases?
The current number of cases is 29, and I've checked it in the last few hours to make sure there's been no change in the CDC report. There are 9 people hospitalized, 15 in Michigan, 14 in Ohio that have the disease, and the age range is 6 to 91 years old. So it's affecting all ages.
Now, the CDC
there's a definite uptick.
Yeah, the CDC is investigating the cases right now, trying to find the origin of that. Given the few amount of cases there are, and 29 does sound significant, but for CDC purposes, that's kind of a small number. How much of a challenge is it to trace that back to find its origin?
It's very challenging. One of the issues is we know there's 29 cases. That means there is a large number of unreported cases out in the community, most likely. So the CDC is even requesting that if you develop a diarrheal illness, report it to the local health department, start recording what you ate in the last week. They need that information for tracing to figure out where it's coming from. We know that it's a foodborne illness.
Now, let's get to the biology of E. coli here for a second. Dr. Dodds, how does this take root in our bodies? And exactly what does it do to our bodies once it does?
So E. coli naturally occurs in our intestines. It occurs in the environment, it occurs in the intestines of people and of animals, and in foods. There's different strains of bacteria. So for the most part, E. coli is harmless to us, but it's when there's a different strain that our body is not used to. There's different strains. Some of the strains can make us quite ill. So what happens is you ingest something that has that in it, it's in your gut, and at that point it begins to multiply. And when it begins to multiply, then you start getting systemic symptoms such as fever, diarrhea, sometimes bloody diarrhea, nausea, vomiting. And some people, the hospitalizations can occur because of dehydration that can occur with such severe symptoms. And also, some people get what's called hemolytic uremic syndrome. It's a type of kidney failure that can occur as a result.
You mentioned strains there. Over the past couple of years, we've heard that word mentioned a lot when it comes to the coronavirus. Now, these strains you're talking about, are they always similar? Can there ever be a repeat of a strain when it comes to E. coli? I'm just thinking about the medical community being able to get out in front of this.
Well, E. coli is bacteria, so we're not looking at a mutating virus type where it's going to just keep coming. But E. coli is a bacteria. There's multiple strains, but the positive is we do have treatments for it. We do have antibiotics and things we can use to help reduce symptoms.
All right, so once this gets in somebody's body, Dr. Dodds, how long of an incubation period are we looking at here? And also, for people out there watching, what are the symptoms that they should be looking out for, and how can they then manage it?
So it's about a 3 to 4 day incubation period after ingestion of E. coli. So within that 3 to 4 day range, you're probably going to begin to develop symptoms. Symptoms can be a fever as high as 102 or greater, nausea, vomiting, diarrhea, and sometimes it's bloody diarrhea. For the most part, for most people, they might get those symptoms and it resolves in 5 to 7 days. But for some people, they get just more seriously ill and end up being hospitalized. So it's important if you develop any of those symptoms and you think about that age range that, one, you note what you've ate, what you've ingested, and that, two, you contact your local health provider and local health department and notify them of symptoms, especially with an outbreak in our community.
All right, we'll keep our eye on this. We appreciate you joining us. Dr. Michele Dodds, Associate Professor of Nursing at Cedarville University.
Thank you.